Mm-hmm. Everything will be okay. I'll talk to you in a minute. Okay, bye.
Hello, Mr. Cohen. My name is Dr. Goodman, and I'm about to ask you a few questions regarding your medical condition. We will use some new technologies that can assist us to evaluate your condition. So, how do you feel today?
Feel okay?
Are you sure? You know, the Vocalis app installed on your cell phone detects changes in your voice and breathing. It might indicate a deterioration in your condition. Have you noticed any changes during the night?
Nothing out of the ordinary.
Do you have a cough?
No.
Do you still feel any shortness of breath?
Now that you mention it, it might be a bit worse than yesterday.
Can you describe what has changed?
I don't know. I feel like I can't get enough air.
I'm sorry to hear that. So in order to help you, I will need to examine you. And as you know, we will be using the checks remotely, and I will need your help. If something isn't clear and you have any questions, please let me know. And please now open the Tyto Care kit next to you, and we will start with you holding the main device. Great, exactly that one, yes. So now I wish to take your temperature. So please hold the main device and press it against your forehead. That part, exactly. Great, you're doing great. So the device now will transmit to me your body temperature. I'm waiting a second. Okay, I can see that you have a mild fever of 38.3 Celsius, or it's 101 Fahrenheit.
It's a bit high. Should I be taking any kind of medication?
So as I told you, it is a mild temperature, and we will be giving you some medication the moment we finish the tests that we're doing. Now we will continue to be listening to your lung sounds. So please connect the stethoscope part.
This?
Okay, Eyal, if perhaps this is a good time while we're seeing the patient using a Tyto to measure himself, you can add some more information about this technology.
So this technology specifically by Tyto Care is a technology that was originally designed to examine patients at the home using telemedicine solutions. So when the patient is at home, the physician is in the clinic, you could examine the patient at home, examine the lungs, listen to the heart, look down the throat, look into the ear, look at any skin lesions and so on. And that was the original intent of the technology. But with COVID-19, the technology actually provided us with an opportunity to minimize contact between the staff and the patient, and thus reducing the risk of the staff contracting the virus. What we've done here is actually implemented it into this robot technology, the Temi robot, and basically allowing us to merge two technologies, which again were not intended originally to be built together, but really allow us to implement the software, the app on the robot, and thus have the robot be also an examining tool for the physicians and not just a communication tool. And this has been really, really successful for us here at Sheba during the past few weeks treating the COVID-19 patients.
So this is the first really technological development of this patient room of the future, the integration between these two devices. So we'll go back to our movie right now, and we'll see how the story continues with the patient.
Directly to your medical file. And for the meantime, please try to rest as much as possible. And if you need anything, please let us know.
Okay, now we're moving forward a little bit. Eyal, now please tell us a little bit about the early sense technology that's implemented here under the mattress of the bed. Go ahead.
So we were looking for a monitoring technology that allows us to monitor respiration rate. We know for COVID-19 patients, respiration rate is probably the most critical vital sign to follow. We had past experience with early sense installed here a few years back and installed in more than a few hospitals in the US, and early sense have really a strong track record in being able to follow continuous vital signs without touching the patient, contactless. and then using an AI algorithm to really alert us when a patient is deteriorating, typically used mostly for sepsis and other types of deterioration on general floors. But here with COVID-19, we thought it would play a good a tool to really allow us to alert for those patients deteriorating. We know COVID-19 patients can be on a very mild course of the disease and then very sharply decline. And it was critical for us to be able to monitor them and be able to understand a few hours in advance when a patient is about to deteriorate. And that's what we're seeing here on the screen as well, with the trend of respiration rate for this patient, and that alarm that alerts us for the change in the trend of respiration rate and heart rate on this patient, using, again, an AI mechanism.
So thanks for that. We're seeing now for a few more seconds this trend analytics that is being used for early. Now we'll continue to see our stories.
Okay. So hello, Mr. Cohen. It's me, Dr. Goodman. We spoke before through the screen. I've come in to speak to you. So I would like to tell you that through the early sense system that is connected to you, we can see that you are having more difficulties in breathing. Yes. And we really would like to see if we can go on treating you here, but we would like to consider the ability to transfer you to the intensive care unit if needed. So first of all, what I want to give you is a little bit more oxygen than you're receiving now through the mask. It's a mask with a bag, do you see, like this? Just breathe normally through it. Okay? Great. Now, I know you might have concerns and questions, and please ask anything that you have to ask. But first of all, I would like to ask you, would you like to speak to your family?
Yeah, I understand. Can I speak to my wife?
Certainly, and we'll do our best to organize it through our screen so that you have better visual and that you can speak to her. Okay? Great. I'll keep you informed.
Okay.